very good, John. So it's all about holistic approach. Very good. So one more speaker before a cup of tea. You see, in England, you must always have a cup of tea. It will come now very soon. So before that, Deirdre? Okay, here it is. Deirdre is from Singapore. She is a physician herself and very interested in holistic approach, and therefore she has given up being a physician and now doing various things, including, yeah, it's working. Okay. Yes, come on there.
Yeah, good afternoon, everyone. How are your brains doing? Okay, at this time in the afternoon, usually, is this okay? Yeah, okay. I'm going to try and do this simply so that you have a feel of what's happening in Asia. As usual, with Robert, he tells you like a few weeks before, can you present a paper? And when you ask him what paper, he goes, how about doing all the mice studies? I said, no, we'll probably do something simpler. But to give you an idea, in Asia, we've probably had ELO-Kaqun since 2015 November, okay? And since that time, we've probably done 2 seminars to doctors. And in Singapore, it's do you call it CME here, Continuing Medical Education? We have the equivalent. I won't go into how difficult it was to get that done, more because on mainstream medicine, I think it's the same in UK, you absolutely cannot mix the two. So our Ministry of Health, when it comes to mainstream medicine, it's mainstream medicine, and everybody is everything else, okay? But we thought for today we'd just present an approach that has happened for us. Skip. Keep it shorter. Okay, basically, my background is I've been a doctor, let me see now, since 1986. But after 10 years, I joined Olivia in water treatment, and we went on a totally different direction, which was treating water, doing desalination plants, wastewater recovery systems. But right at the end, I retired at the age of 45, by the way. That was in 2007. There was one area I really wanted the company to go towards, which was the area of longevity village water. A lot of people don't understand that because we are taught Mediterranean diet. Okay. But I think this seminar is critical, and I really thank all the previous speakers because it's been very interesting. Everyone's got their own angle to this. And what we found was, I think up to the point of nutrition, most of us have some inkling, but when it comes to oxygen and water, it's not taught either way. Neither on the mainstream side. One day I was talking to a whole bunch of nutritionists, naturopaths, and traditional Chinese medicine. We have a lot in Singapore. And he said, no, when it comes to water, we all try and figure it out ourselves. So this is a very important seminar in that sense, because it's supposed to be meant for sharing. Now, Asia, I'm going to take a different tact, and I'm going to mention a bit about bioenergetics because it's big in Asia, okay? So what is it? Okay, this side of the world, you all call it energy medicine. Our side, we just call it energy health, qigong, pathways. This is important because we've always had this tradition, and Asians have never left it. I'm going to say another way. If today traditional Chinese medicine was stopped in Singapore, about 40% of the population will violently object. Okay. Also, we've always been familiar with bioenergetics, and like the Europeans, we are quite steeped in herbal supplementation. Okay. And how is Western medicine seen? For most of part, it's seen as the mainstream only form of authoritative medicine. However, more and more, it's looked as a form of treating acute conditions. You have a road traffic accident, for goodness sake, go to hospital. If you have diabetic ketoacidosis, go to hospital. But by and large, everything else that's chronic, which is almost everything else, whether you take cancer, whether you take hypertension, diabetes, whether you take chronic pain, we really have to look at it from a cellular point of view. Maybe the short word would be cellular health. This is actually by Forbes. These, again, trends, what's happening for us in Asia. I don't know if you've noticed, most of the human civilization is on our side of the world. We've got like a billion, you know. You have a billion Chinese, you have a billion Indians, probably a bit more because, you know, they don't take their census as tightly. And then you have the ASEAN, the whole bloc. When you add us all up, there are a lot of us. And one thing that's happening is a lot of them are actually flying out. They're flying out to Germany. They're flying out anywhere they can find alternative therapy. The other very interesting is China. I heard there's quite a few of you that are naturopaths. Yes? No? Okay. A lot of drugs, okay, I shouldn't call it, supplements that you cannot find in America or in Europe anymore. I give you a secret. Go look up the Japanese and the Chinese. The reason why is when everyone comes up to them and says, no longer approved, they go, 你在讲什么？我不懂你们在讲什么. In other words, they pretend they do not understand the English language, which helps the rest of us because you can find a lot of things still in Japan and in China. Okay, that's just a little hint. Okay, this lady is actually a Chinese physician, Professor Ko in the National University of Singapore. And I like the fact that I think the whole World Health Organization's, WHO's definition of health has never changed since 1948, by the way. It's always been a state of complete physical, mental, and social well-being, not merely the absence of disease and infirmity. And I think round and round, whether you are a functional medicine doctor, as in the Western style, or you're a naturopath, or you're a TCMer, as we call it, I think all of us are really going in the direction of integrative medicine. You know, I can use this word in UK. In Singapore, we can't use this word. So we choose to call it integrated health. And the long and short is, it will require a complete holistic approach with different modalities, ideally informed by evidence. I'll speak more about TCM because, well, that's what we're more familiar with. But the long and short is it looks at a person as a whole. It stabilizes yin-yang, the balance of qi, and basically to stimulate your own body's ability to heal. And that's why the diet and the lifestyle are very important. Again, interestingly, if you look through this whole list, we have got nutrition, but this whole bunch here, a lot of people wonder what it is. This would be the Chinese version of energy medicine. And what is interesting, in Singapore at least, the three most commonly used complementary healthcare approaches are actually non-vitamin, non-mineral natural products, which are actually herbal, deep breathing, and Qigong. We are a lot, if you look down this list, I'm sure, because some of you from UK, the States, as well as Europe, it looks quite different from what you would have. Even though we have everything there, but the approach is slightly different. Again, I'm not big into commercial, but to give you an idea, for those people that are just not convinced, I always tell them, do you know the size of this? At the rate we're going, it's something that is expected to become a major part of the health approach and the health industry in the world. I wouldn't even say Asia. And what is interesting is the hotspots. Okay, Europe and Asia Pac are still #1 in terms of the emerging growth. The rest will pick up, whether it's Latin America or Middle East. That's why you see a demand. But why is this important? Because, Robert, that's what this conference is about. It's a mix of the Europeans. It's not yet Brexit, right? So still Europe, right? Britain. As well as, I think, Asia Pac. Now, what do we actually do? Where I come from, we've got 2 aloe bath centers, one in town and one in a mall, okay? And what we did was we actually put an integrated health center within the bath, okay? Which makes a lot of sense. Otherwise, people get in the bath and they go, what's this? We're sitting in here 50 minutes and we come out. It's very hard to explain if you're not either at some form of a practitioner. So what do we actually do? Now, in the first place, getting it organized was already difficult enough, because I always said the problem with practitioners is not the practice. It's just 3 letters, EGO. Agreed. I think ego is a big problem, and I'm glad to see this group, because the very fact you're sitting together and from very different backgrounds, obviously there's a combined desire to learn together and to look at things from a different way. So what do we have? This is in our center. We always place it, oxygen and water is number 1. Simple logic. You don't breathe, you die in 3 minutes. You don't drink 3 days. You don't eat 3 weeks. So that's an order to this. So, okay, bath, very important. Bioenergy, chiropractor, nutritionist, naturopath, traditional Chinese medicine, and family wellness, health. This wasn't intentional. It's because the doctors there theoretically have to use the word engaged medical practitioner. Okay, that's how we get around the medical legal part of it. Okay, and when you look at things, we actually think this way for combined healing. The Western medical is absolutely important because of diagnosis, because of follow-up, because of treatment of acute conditions. And I think that's something none of us should run away from. But in terms of cellular health, it's in this order: oxygen, water, nutrition. Actually, when I use the word physical fitness, probably a better word would be rest. A lot of people just can't rest. If you can't rest, you can't get your parasympathetic going, as Sandor would put it, you're dead meat. Mental wellness, purposeful living, and joy. And any therapy that helps it. So right up there would be ELO-Kaqun, simply because of the oxygen factor and the good hydration. We use everything. We use the drinking water as a basis. We have to use the baths. This is what the center looks like. This is, I must congratulate Olivia. Every center she builds is always beautiful. So it's a very nice, restful place, as well as we use the gel. We treat almost every condition. In fact, sometimes I think we're running a tertiary hospital down there, because we've got, on the one end, people who are just coming for wellness, but the other end, palliative and stage 4 cancers, and usually the worst, and everything else in between: diabetics, hypertensives, endocrine problems. Saint Georgi. Did I say it right? Georgi. Okay, close. I think the other aspect that I mean, he's Hungarian, that's why we have to acknowledge him, by the way. You know, Robert and Kulin will be, he is Hungarian, isn't he? Yeah. And what was very interesting was his statement that in every culture, in every medical tradition before ours, healing was always accomplished by moving energy. I'd love to carry on the conversation on the post-traumatic stress syndromes, because we see a lot of depression cases, and we actually combine it. It's not only the nutrition, it's the oxygen, and we use a lot of bioenergetics. How fast? Very fast, the effects. And why? Because of TCN, Ayurveda, and other practices. In fact, I'm going to say it this way. We know that energy and information flow through the body in highly organized pathways. People always ask me, what is it? Okay, we just call it bioenergetics, but essentially it's every form: microcurrent, PMF, far infrared. And why do we tend to use this together with ELO and Kaqun? It's because of the speed. Okay, in the past, I think before the age of the computer, you really are very dependent on a very good therapist. In Asia, we use Qigong masters, Ayurvedic masters, but I think even this side of the world, okay, if I had to look for a European, I'll look for an osteopathy. Why? Because I think when they deal with the facial planes, we have a lot of results. Sometimes I use chiropractors, but this is very important because it is non-invasive and it is inexpensive. The other thing is we find that when we combine it together with ELO-Kaqun as well as nutrition, your results are just accelerated. These are just some of the gadgets. Okay. I'll go through this all very quickly because I just want to come case studies. We have chiropractors, but we tend to deal more on the functional side of it. For example, someone with maybe gut problem, after we've treated, the last bit would be adjust the lumbar spine and voila, we get good results. Nutrition, I think most of you are familiar with it. Traditional Chinese medicine is big for us. Mental and wellness, mental states, and the doctors. In the ELO baths next door to us, we actually have the mainstream medical doctors, family medicine practice together with the specialist coming in once a month. Why? Because when you have bad skin, dermatological cases, subfertility, infertility, cancer patients, it's very helpful to have a specialist around. Okay, I'm just going to run through very quickly. I'm good on time, right? Yeah, I'll finish quite quickly. Give more time to my two colleagues from Malaysia. We've decided to give you all a mix. Nasri, I'm setting him up so that you don't have brain fog by the end I'm done. You might have after what he presents. but Dato will present before that and show you some case studies that we have. I'll run through this very quickly to give you ideas. An 84-year-old Chinese lady. She was diagnosed with dementia 5 years earlier and with stage 6, 7 after 2 years. In short, she's bedbound. She was bedbound, bedridden, unable to recognize, incontinent, and with a Rouse tube. So what happened? It was an interesting case because it was actually a lady who did lymphatic massage. There was a granddaughter. And she said, she asked the patient, what have you done? How come you seem so much easier to massage? He said, I'm drinking this thing called ELO. In Singapore, we call it ELO. And she gave it to her grandmother, just a little bit, maybe about 500 mils at max as a start, through the Rouse tube. And after a week, she started, she wasn't making any noise, she was just quiet in bed. In short, the family were prepared to bring her to a tertiary nursing home and to die there, essentially, of probably aspiration pneumonia. So why not try? So they just put a little bit through the Rouse tube. Within a week, there was gurgling sounds coming out. Within 2 weeks, she started, the chewing reflex came back and she started simple Chinese conversations. After 2 months, and this is interesting, so she went from bedbound to a chair. She started taking off her pampers and knowing that this is not quite right. She was at a doctor's visit and she was in a wheelchair, and the granddaughter turned away, looked around, and noticed she had walked to the doctor's consult. Now, you've got to understand this. I don't know. Doctors throughout the world, I don't know why our waiting time is bad. It's always bad. but so it is in Singapore. She's waiting an hour, so she knocks on the door and says in Chinese to the doctor, why are you taking so long to see me? So voila, she was discharged and she's gone home. Case of spinal stenosis. I'm just going to give you a mixed match of cases so you have an idea of how we actually deal with all this. I'm a new fan of Dr. Mate. Where are you? I told Robert, you're no longer my number one. Because I just love the basic sciences. But anyway, I think everything that's expressed in the basic sciences will manifest in the clinical situation. So what's happening? This is a lady, 77-year-old Chinese lady, severe spinal stenosis since 2009, L3 to S1, presenting with neurogenic claudication. So she walked about 5 minutes and then she has severe pain and have to just squat. Was advised surgical decompression and fusion. She declined, and she presented in 2017 again with numbness in the right leg, especially L5 distribution, and right-sided backache with radiation to the right leg. Just to give you an idea of the x-rays, you look at a spine. Having said that, we never treat an x-ray, but this is really a real patient. Now, if you look at every level, this 2009, you can see why the surgeon recommended. You look at the levels, you just look at a spine and the amount of obstruction there actually is. There's hardly any space there. So they wanted to operate on her. She said no. And I'm a great believer in prayer because that was it. Lord Jesus, heal her. And for 10 years, she was literally, is that 10? More, short, 8 years. No, it's more than that. She was actually well preserved, and then she presented again with pain. Looking at this x-ray, it's still bad. But what did we decide to do? Because she just would not have surgery. First, she started drinking. She went to baths, but we combined it with bioenergetic microcurrent, PMF, far infrared, on a therapeutic program. And we put her on nutritional supplementation. And just one review for a chiropractor who just prescribed her gluteal exercises. That was it. After about 6 months, there's no intermittent collocation. Surgery is no longer mandatory. She's able to walk long distances, no longer significant pain, and able to live independently. She comes in every 2 weeks just for what we call a top-up, meaning she goes for a soak at a bioenergetic session, which takes 1 or 2 hours, and that's it. Oh, I thought I'll put this up in case you're wondering what we actually look at. Okay, this one's a microcurrent. Just give you an idea. Green, blue, pink, these are just the channels. So we have electrodes. She would have been placed here, 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 one down, okay? So there are areas we actually place the electrodes for the current. And what I wanted to show you was, if not for the ELO baths, why it's very slow on bioenergetics alone. And I think that's where people miss it. People who believe in energy medicine don't seem to believe in anything else. Those who believe in nutrition don't seem to believe in anything else. But I think everything together is important. So what happened? She went for the bath. What you will find is the result. It's just a lot quicker. This is a case of a chronic inflammation. So, okay, in energy medicine, it's always a norm. So for this particular machine, it's between 40 to 60 resistivity. It's high. What you want it here, in between these two lines. And what happened was, because of the ELO bath, it's almost immediate, the response. So what is low, the machine is literally cybernetics. It'll kick up, it'll stay up. What's high, it's kicked down. And by the end of 2 cycles, what you see is the whole energy part's actually regulated. So you can actually monitor this week by week and month by month, and you can actually see where they're actually at. Okay, this is a patient. Some people said not to show it, but I said, no, you must know reality in life. So this is, no, you mustn't all show the good stuff, right? We're all physicians. We should share this bad stuff so that at least we can help each other out here. So this is a 57-year-old gentleman. Now, this is a case that, again, he's at a very young age, he was diagnosed with fatty liver. I must tell you something. He was a meat-eating guy up to around about here, and he became an absolute vegan. But you must understand, when people say they're vegan, you must ask them what exactly do they eat. In Asia, when they say they're vegan, doesn't mean they're healthy. It's a very starch-based diet. It's not your salad. Yeah, salad's a bit of it. Most of it's starch. This is very, very important because even after that, notice at the age of 25, high uric acid and cholesterol, high blood pressure by 28 years of age, diagnosed to type 2 diabetes from 46 years of age. You would agree this is a case of 3 things: hypoxia, chloric inflammation, and oxidative stress, full stop. And, oh, it's a strange thing. He's been snoring since childhood. In other words, he's sleep apneic from a very, very young age. And that probably couples everything because sleep apnea really, really pushes up the hypoxic issue. Hair loss from a very young age and onset of tinnitus. This is actually why he came to see us. He said, I've got this ringing sound in my ear and I can't hear in one ear. And I've got a right upper abdominal pain, probably from the liver. These are the medications he's on. Okay. Results. He came in August, triglycerides high, SGOT, yeah, it's high. Remember what I just said to you. The hardest thing to change is actually lifestyle. Sugar, basket case, I mean, he's young. I mean, he's just on metformin, 500 milligrams BD, and he refuses to take anything more. This is after we treated him for August, September, 3 months. Triglycerides came down. liver function improved, but his sugar has remained stubbornly high. And there's a reason for that. Unless you can change his diet, I've got no comment. We're trying to work on him on that. But I want to show you something. This is what we put him on. Again, he's a vegetarian, so we left him on his supplementation. We put him on ELO baths 3 times a week. But very, very quickly, within the 3rd bath, okay, I'll show you some of the scans, but within the 3rd bath, he was exhausted, but by the time he reached the 3rd bath, he suddenly had this surge of energy. He felt it. His hearing improved. The snoring was audibly a lot better because they're lying down on the machine, so we can hear them snore at the same time, so we know where they're at. And what was fascinating was his facial features started improving. The skin, I would say anti-age, maybe he looks about 5 years younger, just over a course of 3 months. And increased growth of hair. I'll show this to you. So the first session when we did it, okay, these are the wellness points. So what was weak was what's passing through the upper limbs and lower limbs. And if you look at the energetic pathways, they go up very quickly because they had the ELO bath. This is very important to understand. Otherwise, you will not see this. By the time it was a 28th session, you notice everything is up. But look at his hair. This to that. I was half-minded to show it, but all the doctors said, you have to show it, Dee, because the picture's worth 1,000 words. Huh? He always knew that. He's too shy to show his face, so we'll leave it as that. But lest you think that diabetes does not have an effect, I have to show this to you. Okay. This 55-year-old lady, she's on both oral and insulin. She is bathing when she came, and she drinks. Now, if you can get the HbA1c down by 0.5%, it's considered very good already for a drug. If you watch, this is over a course of 4 months. Her sugars dropped, HbA1c dropped, but more than that, you notice her insulin, we had to keep dropping it. She had a few episodes of hypoglycemia. So that actually tells you the pathways are quite fascinating. The last case, again, will speak for itself. This is a gentleman, 50 years old, with psoriasis. He's tried every treatment and came to us. Within 4 days, it started drying up. By 14 days, it's just gone. I won't show this because I think we're out of time, yes? Okay. Huh? Okay, then you just listen to him and I'll take my leave. Now, how do you turn this on?
Yes. Yeah, because I'm a frequent traveler for business, so I have to spend a lot of time flying. And for the past 15 years, I developed a problem of psoriasis, which is very severe. It's like whole body. And also the second problem is obviously I have a lot of sleeping problem. Cannot go to sleep at night. So I decided maybe I should give this ELO water a try, because I have actually studied the background of this ELO water, and by soaking and drinking. And surprisingly, the first day I tried versus the 4th day I tried, I already saw dramatic result as psoriasis disappeared by almost 70%. And then by drinking water, I can sleep much better now. Although the first day you feel tired, but the subsequent days you can sleep very well. So I'm very grateful I had a chance to experience this water, and that's why I'm into my 3rd run of soaking and drinking, and I really guarantee this water works.
Thank you very much. Here you are. So, we are going to have tea. You're going to have an English tea. Let's go and have that, and then start again, please. Come along. Let's go and have tea. Well done, all of us.